Welcome. These are this health equity webinar series that the Division of Social Accountability has been holding for quite some time. My name is Manuela Valle Castro, and I'm the director of the Division of Social Accountability. We are a unit in the College of Medicine that is dedicated to embed equity frameworks, anti-racism and anti-oppression in the college at all levels of learners, and to make sure that the College of Medicine upholds its mission to form physicians that are able to respond to the priority health needs of their communities, the communities where they're situated. And we are a unit of settler people in a colonial institution. So I wanted to invite you all first to ground our conversation and an understanding in the recognition that we are today gathering to discuss and to work and to reflect together in Treaty 6 territory. That this is the homeland of the Métis and the traditional land of Nehiyaw and other indigenous peoples. These are indigenous lands, and as a unit of grateful guests, the DSA looks to be in allyship and to support practices and frameworks that respond to redress the colonial harms that institutions like our university or even our college has perpetrated. So today, as you know, we are focusing this month on harm reduction. And we actually made a typo in one of our invitations, and we wrote harm reduction, which we thought, oh, that's a nice typo, because we do need a lot of education around harm reduction. And there's a lot of misconceptions and a lot of stigma. And frankly, like a willful ignorance and resistance from a lot of our decision makers to embrace the evidence around harm reduction and the potential outcomes and impacts that it can have in our populations. So we invited our amazing partners from both the community and from our amazing students to have a conversation today on what is, since we have recently learned that once more our provincial government is refusing to fund harm reduction initiatives and practices, how are communities responding to the needs, the health needs of people who are drug users, and how are we responding to the health needs of our communities in the context of an opioid crisis, of an HIV crisis, and yeah, so today I'm not going to take too much space. I just wanted to invite you to learn today and to listen and to engage, hopefully connect later with our guests. We have Kayla DeMong, who is the executive director of Prairie Harm Reduction, which we are super fans of, as probably most of you here, of their work. And we also have another very, an organization that is very close to our heart, which is chokecherry. And they're going to be presenting on their Blank Book project. We have a couple of folks who are going to introduce themselves as well from the Student Harm Reduction and Informed Policy advocacy group. And we really wanted to highlight again and amplify the efforts that are coming from our community partners and from our student advocates to respond to the needs of educating and advocating on harm reduction. So I don't know if we discussed the order in which you're all gonna go, because we are very much like this, very informal and friendly. But maybe I'm gonna ask if the youngest would like to go first? How are you feeling, Jade and Kiari and Andrea?
Oh, I thought you were talking to Kayla.
Is Kayla the baby?
I thought so.
Yeah, definitely not. I have babies older than Jade and Kiari, so I'm pretty sure I'm not the youngest one here.
Right. So maybe I'm going to suggest as an order that we have the blank book, the students, and PHR. Does that work? Okay. So yeah, they're going to have like around 15 to 20 minutes each group to present, and then we're going to have some conversations. So thank you. Thank you so much for being here, Jade and Kiari and Andrea. And it's all yours. The floor is yours.
Okay, awesome. Well, yeah, my name is Andrea Cessna. I'm the Executive Director of Chokecherry Studios here in the city. I have Kiari McNabb and Jade Krillman here with me. They were the youth leads on the Blank Book project. Kiari is currently working in a position with the Saskatoon Poverty Reduction Partnership and Anti-Racism Network through Chokecherry Studios. And Jade has worked at Chokecherry the past 6 months as the Wapaki Assistant Coordinator, and that's about to change, but I won't spoil the surprise. So today we're going to be talking about the Blank Book that the youth-led project that we did in partnership with the Safe Community Action Alliance through the Crystal Meth Working Group. I'm just making sure, there we go. So this is the cover of the Blank Book. Get to know it, get familiar with it, and if you see it, make sure that you tell other people about it. So I'll just start things off by providing a bit of background on this project. So it would have been in 2019 when I had a conversation with some folks who were developing this report, A Community Response to Crystal Meth in Saskatoon. And at that time, I asked them if there was any engagement with young people around crystal meth. And they said, no, but that would be something we'd really be interested in having. And so we worked with them in 2019. And we probably had about, I think we had one meeting planned, and it turned into about 4 or 5 meetings. This is a topic that is close to a lot of the youth in the community that access Chokecherry. And so we thought maybe it would be a cut and dry, like here's what we want to contribute. But as we went on in this process, I mean, it became really clear that the youth wanted to do more than just share their stories. They wanted to critically engage with the content in the report. So the section of the report that was prepared and collaboratively written by a group of Indigenous youth and adult allies kind of exceeded our expectations. This is what the youth wrote. It says, as youth living in inner city Saskatoon, we see the impacts of crystal meth every day. Some of us have been, and some of us are users. Some of us have watched, and some of us are currently watching crystal meth devastate the lives of our loved ones. We came together to share our stories and lived experiences in hopes of putting forward our own recommendations. Our experiences are as diverse and colored as the lives that meth seeps into. Oops. We know that the crystal meth crisis cannot be addressed without taking into account other issues such as colonialism, poverty, and trauma. The policies of our institutions and a lack of access to services and resources play major roles in the health inequality and widespread use of crystal meth, especially among youth. For this reason, crystal meth should be seen as a syndemic, a synthesis of multiple epidemics affecting our communities. So originally, we thought we would do some stories and some quotes and some statements about the impact of crystal meth. But as they kind of went through the report more and more, the youth participants really took an interest in critically engaging with the content of the report, and in particular, the 5 core areas developed in the report to categorize the recommendations. And these were treatment, prevention, harm reduction, enforcement, suppression, and data. And I'm just going to provide a link in the chat right now for folks who are interested in reading that entire report. It's very well done. And at the end of the report, you'll see all of the recommendations from these 5 categories. So after all of the work and all of these meetings, the youth ended up with these 5 recommendations. So the first for treatment was to provide facilities for a crystal meth specific treatment and rehabilitation center in Saskatoon that offers transportation, family accommodation, optional cultural programming, and access to elders. For the prevention category, the youth suggested that a 24-hour drop-in center and youth shelter providing all services to individuals under the age of 18. For harm reduction, they proposed establishing an outpatient supported living and housing program for addicts and implement a managed crystal meth program like CMAPS within the city of Saskatoon. For enforcement and suppression, the youth proposed mandatory trauma-informed training for police and emergency services to effectively and safely intervene and provide care to users, implement a policy for mental health professionals to ride with police officers responding to crystal meth related calls, and to build relationships with persons in the Saskatoon community that have historically been over-policed and underprotected. And lastly, for data, the youth proposed conducting a study examining the syndemic factors contributing to crystal meth crisis, like racism, like poverty, and a subsequent comparative study after the above mentioned recommendations, the previous 4, had been implemented. So the youth went hard. They went all out. They presented this to the city of Saskatoon, as well as STC, the University of Saskatchewan, and other leaders in, sorry, I'm messing around with our, whoops, nope, I'm going the wrong way. Sorry, guys. They went above and beyond with this report. And it became really clear after their work that having youth involved throughout the entire crystal meth working group initiatives was going to be very key. And so I guess it would have been following the publication of the crystal meth report, that's when the crystal meth working group said, hey, we need youth to be involved in this project on an ongoing basis. And that's kind of what led to getting Chiari and Jade integrated. So I will pass it over to Chiari to tell you more about how the project started.
Hello, thank you, Andrea. I'm a bit nervous, but hey, I just gotta get to my notes here. Sorry about that. So, when we first started this project, I was really excited because this just the whole stigma around it kind of really signifies me in a lot of ways. So I guess in January of 2021, Crystal Meth Working Group asked us if we wanted to do a youth-led harm reduction project. Of course, we said yes. And so we had came up with the idea of a blank book that actually came from an idea of a fill in the blank kind of journal I'd seen days before. And I kind of thought this could be something where community members could share their stories and write it down into any form as they please. Like you could see the art that you have seen already that Andrea peeped. Yeah, we wanted to let them express it in many ways. I didn't want it to do just writing. And so from there, we realized we could actually utilize our partner organizations that have connections with community members to spread our concept even further. Our goal from 10 submissions to 50 in the book initially turned into I think 35 submissions into the book that made it in. So, So then over the couple of meetings that we've had, we had our partners, PHR, the Lighthouse, CSHA, Saskatoon Health Authority, and then the SCAA. Now we had them collecting submissions, which was a bit of a messy process as we had to deal with the waves of COVID, but we did end up making the book. And I'm sorry, just my notes got really tiny. Okay, sorry about that. Thank you, Sharissa. So one of our critical parts of the project was to ensure that the community members would remain anonymous because the stigma associated with the crystal meth use is so severe. People are afraid or unwilling to talk about it openly. For this reason, we chose to keep all submissions anonymous. So instead of their names, we asked them to provide words they identify with, like artist, sister, teacher, along with their age. We hope that by including these identity markers, we would humanize their stories even more. Then here are some quotes with just like the format of what we had in the books. So our expectations, initially we aimed to printing off 250 to 500 copies of the blank book. We then thought that'd be too many and we'd have so many copies just sitting around here at chokecherry that instead we were blown out of the water by how many people responded, which left us with no copies for ourselves. Because they all went straight into the community, we were more than happy with how things turned out with that. Before we had even placed the order for the second print, we had already had over 100 pre-order books. So with that being said, that shows that the community is really interested and wants to learn. And so that kind of leads into what we did learn. I guess I never knew that the community had cared this much about this topic and just how many supports there really are for people that use. And I guess I just want to thank for everything. Thank you for all listening. Yes, our next slide. So the next step is
So we've got a list of about 20 people, I believe, in positions of power that we will be mailing these books to. And another amazing thing that came out of this edition of the blank book is, I'm rushing through this, hold on. So what emerged from the project was the significance and potential role of art and storytelling in the realm of harm reduction, especially for me as a youth and as an artist and as an individual with lived experiences of crystal meth in the young and as a young professional in this line of work. The blank book project acted as a slingshot for my interest and passion. It made me curious as to how I could continue to compile stories and amplify the voices of people with lived experience, possibly through future editions, covering other substances such as alcohol or cocaine. So after the release of the blank book project, we began to work on a grant to help create a youth-focused harm reduction program at chokecherry. And we're super excited to share that our application has been approved, and we will be launching a new weekly program called Community as Harm Reduction this June. This will be a multifaceted program offering naloxone training and take-home naloxone kits to youth across Saskatoon. It will include a peer support group for youth who have lost family members, friends, and loved ones to overdoses. We'll be preparing and distributing youth-friendly educational materials about harm reduction. We will be providing a 12-part harm reduction workshop series. We will be coordinating youth-led social media campaigns to raise awareness and collaborating partner organizations such as PHR, Mom Stop the Harm, and hopefully SHRIP on the second edition of the blank book, tentatively titled Opioids and Overdose. And right now, Andrea will put the link in the chat for the crystal meth edition of the blank book, as we still have a few copies left and we would love to get them into your hands. As far as age restrictions, I think we will go with the chokecherry definition of youth, which is about 11 to 29. So it's a pretty broad age range. And that's all we have. So if anyone has any questions, we'd be happy to answer them now.
Thank you so much, Jade and Chiari and Andrea. We're going to leave the questions to the end, but thank you so much for bringing your amazing voices to this space. And we hope to keep working with you, as you know, and we're going to keep making more connections. So can I invite then our students from SHIP group? And then hopefully, yes, please. Andrea and Jade and Chiari, if you can put all your contact information in the chat so people can follow up with you. And yes. Trip.
Okay, hello everyone. My name is Erin, and I am one of the incoming co-presidents for SHRIP, which is the Students for Harm Reduction and Informed Policy. My other co-president is Ryan Krotrack, and you will hear from him shortly. You'll also hear from Claire, Lindsay, Alex, and Erin, who are additional lovely members of our incoming executive. But before we talk about our group, we did want to extend a massive thank you to the Division of Social Accountability for allowing us to speak today. We recognize that as medical students, we do have this really unique opportunity to advocate for groups that are like intentionally disenfranchised and stigmatized within our communities. And it does mean a lot that we have the support of the DSA as well as the college in general. We'd also like to mention what a massive honor it is to be a part of this conversation in the company of Chokecherry Studios and Prairie Harm Reduction. We're all here, I assume we all know, but these community-based organizations are doing incredible work, and our role with SHRIP, we can only hope to support the work that you are doing. So thank you for allowing us to be here as well. And then a final thank you just internally to our VP Communications, Adam, for organizing everything required for us to be here, and to Erin Tilk for designing our presentation. And then I'm going to hand it off to Ryan to start introducing you to our group.
Hey everybody, so as Erin said, I'm Ryan. I'm the co-president. I'm going to be at the Regina campus next year. So yeah, we're the Students for Harm Reduction and Informed Policy. So we're a recently ratified SMSS student group. And we were founded by the members of the class of 2024. So I kind of want to name some people, Saya, Anthony, Boljeet, Adrian, Sarah. Really, we have to give so much thanks to them. They worked so tirelessly to get this group off the ground. And really, we wouldn't be here speaking today if it wasn't for them. Yeah, so I guess the main goals of our student group. So we want to advocate for evidence-based harm reduction policies. Obviously, this year we've had the opportunity to meet with provincial ministers, but coming in the new year, we're looking at, hopefully engaging with both the, not both, but federal, provincial, and municipal governments throughout the province. We want to collaborate and support community-based organizations, whether that's through donations, fundraising drives, or even just physically volunteering at these places. And we also provide educational opportunities for health science students at the University of Saskatchewan. We recognize that as future healthcare professionals, it's so important that people are educated on these topics as they transition to the workforce. And yeah, it's just so important. These are such pressing issues, and it affects almost every area of medicine. So we just want to make sure that our colleagues are educated. So currently we are the largest SMSS student group. So we're split into 4 different task forces. So we have our events task force, our community engagement task force, policy, and we do some social media stuff. So I'm going to hand it off to our task force leads for the upcoming year, and they'll kind of talk about their task force.
Okay, hi everyone. My name is Claire, and I am part of the events task force for SHRIP for the upcoming year. So I just wanted to start by highlighting what our main goals are in this task force. So through our events, we hope to raise awareness of our group among our College of Medicine colleagues, provide opportunities to learn about harm reduction, and to host fundraising events to support initiatives within SHRIP, as well as local community organizations. So I just wanted to give an idea of what the group has done this past year in terms of our events. So here are some examples. SHRIP has hosted a harm reduction trivia night, which was a mix of education and fundraising as well. There was distribution of naloxone kits at other College of Medicine events. The group has also organized many educational talks for students, including on the topics of psychedelics in medicine, trauma-informed care, and substance use among physicians. And these educational talks were put on in collaboration with other College of Medicine student groups, as well as members of the community who joined us to share their expertise on these topics. So for the upcoming year, we're really hoping to bring back some of these great events from the previous year, in addition to some new ideas. We're hoping to provide naloxone training in our college, more trivia nights and other fun fundraising events, as well as more educational talks in collaboration with other groups and community members as well. So there's lots of planning to be done for events, but I'm really excited about what's been done so far and what we can do next year. Thank you, and I'll pass it along to the next task force.
Okay, hello everyone. My name is Lindsay, and I'm the leader of the Community Engagement Task Force within SHRIP. Before I get started, I just wanted to reiterate what an honor it is to be presenting among such amazing and impressive community members here today. It's truly, truly a privilege. But anyways, our current and ongoing goals within this task force is to develop relationships with local organizations and community members and find the best ways that we can support them. So we really want to develop those long-term and meaningful relationships with a wide variety of community organizations. In doing so, we recognize that harm reduction isn't just isolated to safe consumption sites, but it goes hand in hand with food security, equitable access to healthcare, affordable housing, the impacts of colonialism, and so much more. So we want to support community organizations and engage in harm reduction in a holistic way. So as Ryan kind of touched on, some of our goals are to provide both material support to community organizations, whether that be through clothing drives or food drives or hygiene product drives and such, or we're going to provide our time as volunteers. Additionally, we are a group of medical students, so by engaging in volunteering, we are increasing our awareness, our insight, and our experiences with what lived experience looks like. And we believe that this is going to help us develop our interpersonal skills and make us the best healthcare practitioners that we can be in the future. So just addressing this slide here, some of the things that we've done so far is partnered with Prairie Harm Reduction. So we have a pool of volunteers that go help out at the safe consumption site. And that has been really extraordinary for us. So shout out to Prairie Harm. We've also done a supply drive for Camp Hope in Regina. And we have also helped stock the Riversdale Fridge here in Saskatoon. So in the future, we want to continue building and developing our connections within the community. We want to especially really focus on garnering support and trying to build connections with Indigenous-led organizations. So, for example, This summer, we're meeting with WINISCA, which is an Indigenous-led center that does research into sexually transmitted and bloodborne infections here in Saskatchewan and Manitoba. So we're going to have a meeting with them and find ways that we can support them. So we're going to try to, as I said, continue establishing these relationships. And these organizations do so much. They do so much amazing things, often with limited resources and limited funding. So if we can just help out, a fraction of what they do for us in our community, we're going to be so grateful. So thank you so much, and I'll pass along.
I think Alex may be having some issues, so I'll kind of take charge.
Oh, it just got back for me. So sorry, guys. My screen was frozen. I did not realize we were on my slides. But hi, I'm Alex. I am the VP External of SHRIP, and I'm also the leader of the Policy Task Force. And if I freeze, somebody else is going to jump in and save me. I have a very unstable connection, so I apologize. So our Policy Task Force, our main goal is really just to advocate for informed harm reduction policy in Saskatchewan as well as beyond. We kind of want to, look towards places that have put in informed and effective harm reduction policies and draw on that and advocate in our province for those things to happen here and for those to be provincially funded. And we also recognize we have a huge privilege with our platform being medical students and having a voice and privilege in the community. So we just really want to use our platform to make change and raise awareness and give a voice to the communities that aren't given an opportunity to have a voice for themselves. And we just want to create dialogue around harm reduction and decrease stigma and just get people informed and get people on board with the whole idea. Okay, so with that, some examples that we've done this year are kind of our biggest event of the year, in my personal opinion, is that we were invited to the Saskatchewan legislature by the members of the official opposition. So the NDP had us as our guests, and we got to attend legislature and see the question period, see everything that kind of goes down in the legislature, and see the topic of harm reduction be brought up and kind of how it was handled. And afterwards, we actually got to meet with Minister Merriman, Minister Hingley, and advocate for provincial funding for safe consumption sites in Saskatchewan and why it's important, and present evidence to them. And that was a really, really cool opportunity and a great meeting. And we actually got to go back with collaborating with the SMSS and do it again a little bit later. And also notably, we published an open letter highlighting economic and humanitarian arguments for funding safe consumption sites in this province and why it is so important. And that we were lucky to get a lot of media traction with that and be featured in some news outlets and kind of get to the public and get it distributed to people that we wanted it to be distributed to. And, going forward from here, we want to keep up these advocacy efforts. We want to keep advocating in Saskatchewan and keep having conversations with the government, but also beyond. We really want to go to the federal government for the National Day of Action, which is surrounded around harm reduction and opioid use, I think in September. So we really want to be a part of that and just keep creating these conversations. I think we have one more slide on policy. So our open letter that I just talked about, we had a ton of support. We wrote the letter, but we had over 200 other students from the University of Saskatchewan backing us with their names on this letter, as well as a bunch of professional organizations, the Canadian Medical Association, the Saskatchewan Medical Association, our Student Society, the Union of Nurses, social work, just so many.
Almost.
Just about made it. But yeah, so we basically just unified the medical community around this project, and then to be able to take that to the government, showing it's a unified medical voice. So yeah, it's really cool. And Erin.
Yes. Hi, so I'm Erin. I am the incoming VP social media for SHRIP, and my big role is just sharing all the work that SHRIP is doing, sharing all the work that our other community-based organizations are doing. And part of the reason why I do what I do and what our task force does what we do is because we recognize that social media is so important in advocacy, and it's such a great tool that we have at our disposal to share information, to educate the public, to share the work that we're doing, and to promote what other folks are doing. So that's what I do, and I'm just going to share some examples of it here. So the big one that you will probably see if you ever visit our SHRIP Instagram page is something called a Lit Blitz, short for Literature Blitz. And essentially what we do is we take an article, so that's, evidence-based medicine, evidence-based harm reduction policies, and we boil it down to the most important information, the most easily digestible information, and we share that with people. So you don't need to be a big academic, you don't need to have a lot of experience reading research papers. We'll break it down for you and share the information. And so we cover a variety of topics, all related to different harm reduction initiatives. So whether that be safe consumption and infectious disease, housing and harm reduction, or nutrition and food security, there's a wide variety of topics. I highly recommend that you all go check them out after this. Little plug for the Lit Blitz. We love them and we hope that you love them as well. Another thing that we did a lot of this year was just distributing SHRIP's open letter. So the one that Alex mentioned that we published and directed towards the Saskatchewan government. We shared it on our social medias as well, and we shared a lot of the articles that came out from the media regarding our letter. And then finally, we've all seen Prairie Harm Reduction's Instagram page, Chokecherry Studios. A lot of local organizations use social media as well. So when we can and where we can, we try to share all the good work that they're doing because, we're all stronger together, right? So anytime that we can boost other people's work, we definitely try to do that. So this is just a little example of one of the Lit Blitz posts that was put on our Instagram page this year. It was made by the lovely Erin White, our co-president in Saskatoon. And this one just covered nutrition and food security as harm reduction. And so this is only, I believe, 3 of the 8 slides. She might have to correct me on that, but I believe there were 7 or 8 slides total. And this is just a couple of them that I grabbed screenshot of just to show you all sort of what they look like, how we boil down the information, and how we share it. And I'll give it back to Ryan now.
I'll wrap up quick. We're running a bit long, but so yeah, basically we just want to advocate, collaborate, and educate our community. And yeah, so do you want to switch to the next slide, Aaron? I know some people are asking for our social media, so everything's listed here. And if you guys have any advocacy opportunities or looking for any collaboration, please don't hesitate to reach out. We're really looking for any opportunity to engage with the community. So once again, thank you so much for having us here and allowing us to speak.
Thank you, Ryan and Erin and Alex and I already forgot who am I missing, and the other Erin, but thank you. That's very impressive, and I'm like honestly so proud of your advocacy and the way that you become activated in this. So we're just gonna make sure that we give enough time to Kayla, who hopefully will catch us up with what is happening with PHR and their latest initiatives. And then we'll have hopefully a couple of minutes for some questions, but we will have to follow up after.
Yeah, so I didn't bring my slides or anything to put up. I'm just going to talk, we have a lot of things that happen at Prairie Harm Reduction. And a lot of people are very aware of a lot of the things that we do. And so I'm only going to briefly touch on those, but thought it'd be also really good to just talk about what is harm reduction as we're talking about this and what this actually means for our communities. Prairie Harm Reduction, we have the safe consumption site, we have a drop-in center. That our safe consumption site provided support for 577 individuals last fiscal year. So it's a large part of our community that is accessing supports there. Our drop-in centers currently serving between 450 and 500 cups of coffee a day, which is a lot of cups that we're going through. We also, outside of that building, operate out of 3 other locations, and those programs focus on families and youth. And so we have an apartment building where our family support team works out of and focuses on families who are at risk of apprehension or who have ministry involvement. And that team works 365 days a year until midnight, providing in-home and community support to families using a harm reduction lens as it pertains to child welfare and child protection. In that apartment building, we also house 8 families, focusing on families who have been identified as, unstably housed for long periods of time. And we also have 2 visitation suites for families who have children in care there. And then our newest adventure is our youth residential care homes. And so we have 2 youth homes, one for male identifying youth and one for female identifying youth, who are 16 years and older. And for lack of a better term, the criteria for our program is that they have been banned from all other residential care programs in the whole entire province of Saskatchewan. So these are youth who have been through every institution, every foster home available, every family placement available, and find themselves in a situation where they have been told that they are no longer welcome anywhere. And so we, use, again, those principles of harm reduction to support youth. Most of them are actively using when they come to us, have very complex behavior needs, and have been displaced from their lives, their whole entire life. And so it's really about engaging them and supporting them and not having abstinence as a precursor for support, which is a criteria for all of our services. And so when we look at everything we do and everything that's been talked about today and this idea of harm reduction is becoming a very popular term. It's something that's being discussed a lot. We have a lot of people in our community that say that they're doing harm reduction work when they're not actually doing harm reduction work. Because at the root of harm reduction practice is this idea that everybody deserves equitable access to health resources, to social resources, that, no matter sexual identity, race, religion, socioeconomic status, everybody should be able to access healthcare. Everybody should be able to access food and housing. And harm reduction really focuses, we hear this idea of meet people where they're at, which has become a very common term. And I hear it used a lot, especially in our professional colleges, where they talk about, we have to meet people where they're at. When in fact, so many of the systems and institutions are set up to actually force people to be where we want them to be at. And this idea of accepting people for where they are at and looking at the underlying reasons to why people use substances doesn't exist. And I think it's really important to understand how our best practices, as far as what has become the standard of care for people that use substances, are not rooted in science at all. They're not rooted in data. They're not rooted in research. What they are rooted in is over 100-year history of this country making moralistic decisions about how people should be treated and what access they deserve to healthcare and to resources. Decriminalization has become a really big topic in the harm reduction world and just in our community in general. And it really does, when you look at the history of prohibition and our drug policies, you see that history started in the late 1800s and early 1900s in our country, in BC, in Vancouver specifically, and is purely racially driven. There is no science, there was no data, no best practice, no medical science behind any of it. It started with race wars between white colonial men settlers that had been here, and their religious views, and at that point really against Chinese and Japanese immigrants that were brought here to build railways. And so we've accepted these standards that people who use drugs are bad, people who don't use drugs are good because drugs are illegal and you shouldn't do illegal things. But there's not a lot of science and data that backs any of that. And so when we look at harm reduction, and the reason I'm talking about all of this is that it's really important as professionals that we really look at how are we framing our approaches to working with people, because it has become completely acceptable to impose our own personal values and beliefs in our workplaces when it comes to the treatment of people who use substances. Because this is the College of Medicine, and I'm going to assume that many of you are part of that college, I'm going to share a story about how screwed up our views of people that use substances are in our medical society or our medical institutions, because we know that people that use substances are not treated fairly when they are trying to access medical care. My best friend, who is a social worker within a hospital, many years ago developed ovarian or cervical cancer and had to undergo a total hysterectomy and removal of a bunch of her insides because of where the cancer was. And when we went in for that surgery, my friend has a history with substance use disorder, and at that point had been clean for not using for over a decade, disclosed that to her anesthesiologist and to the doctors and said, like, I have had these troubles with drugs before. It's been a long time. I feel stable. I have all of the supports. The anesthesiologist and the surgeon were really wonderful. She underwent a 6-hour surgery. And that night, she got out of surgery late in the evening. We got her settled in her room. And that night, the nurse refused to administer her pain medication, solely based on the fact that it said in her chart that she had a history of substance use disorder. We have a friend who is a doctor on that ward, who she contacted in the middle night. She contacted myself and our other friend who's a physician and said, like, I'm dying. I don't know what's happening. I'm here all by myself and they won't give me my pain medication. My friend who's a physician went in to ward in the middle of the night and had to administer the medications herself because the nurse refused. And in her chart had written that she was drug seeking because she was requesting her pain medication. My friend also, who is very white, has a last name that sounds like it may be Indigenous, and nobody asked her if she was Indigenous or not. The next morning after all of this had happened, First Nations and Inuit Health showed up in her room with packets for treatment referral, like for treatment centers, asking if she needed to go to treatment for her substance use disorder. And so nobody talked to her. Nobody asked any of us any of this. All of these things were done based on one of the personal assumptions and the personal views of people that use substances by one nurse, which then spiraled into what turned into days of struggling with her stay in the hospital. And so I know we're like almost out of time, but I share this story because I feel that it's very important when we are working within these institutions and within these structures that we really examine why we are feeling the things that we are feeling and why we are approaching people the way that we are approaching them. Prairie Harm Reduction's programs are based off of the fact that people that use substances are treated abysmally across all sectors in our society. We are living in a province where we have now an overdose epidemic. We have nation-leading HIV rates that we have had for well over a decade now. For the first time in many years, we had HIV-positive babies born in this province this year. We have a whole part of our community who pretty much in any other place in the world, if they were to contract HIV, would live long and healthy lives. Our lifespan for a person that contracts HIV in our community is less than 10 years. We have people who are in their early 20s dying of AIDS because of the way that they are treated within our healthcare institutions, and because so many of the policies and procedures that we operate off of are purely based in discrimination and racism. There's a reason why Indigenous people are overrepresented when it comes to our HIV transmission rates, our overdose numbers, our child welfare numbers, our justice system, and that is because the policies that we operate off of are absolutely rooted in racism. There's not a lot of fact or data behind any of them, and that it's very important as students and as institutions like the College of Medicine that we really look at how we're educating the professionals that are coming into our communities. We aren't taught very well about addictions. My background, I went to school to be an addictions counselor, and we learned very little about what substance use disorder is. And, you know, we talk a lot about trauma as this underlying cause and all of these things. But we're not actually taught how to work with people and really how to examine substance use disorder and support people that use substances very well. When we take away substances from somebody who has had a lifetime of trauma without replacing those coping mechanisms, we are not setting people up for success. We jump very quickly into forcing people into treatment, forcing them into abstinence-based services without looking at why people are doing the things that they do. People make the choices that they make for very good reasons, and people do what they know. And for many people that use substances, what they know is using substances to deal with all of those underlying things. And so as professionals, it is our responsibility to treat those underlying things first. And if we can, and that's where it comes into, you know, sobriety should not be a condition of housing. Sobriety should not be a condition of accessing food security. It should not be a condition of accessing healthcare. It should not be a condition of accessing mental health supports. You know, when I also have a history of substance use, and when I ended up being committed to a psych ward due to drug induced psychosis, I was passed between the hospital and the psychiatric ward many times because it was, oh, well, maybe this is mental health, we'll send you to the psych ward. Maybe, no, she's a drug addict, we can't help her in the psych ward. You need to go back to the hospital because your blood pressure is bottoming out. Or no, you need to go to 12-step meetings and just fix yourself. And that is such an abysmal way to treat people that we are supposed to be caring for. And so, you know, I just want to end all of that by saying, you know, as professionals and people going into the helping field, it is our job to help people, and it is our job to treat people well when they're accessing our services. And our personal beliefs or opinions on, you know, how of what substances are and what, you know, how we feel about people that use substances should never be a factor in our ability to treat people. And, you know, if that is something that you really can't get through, then this is not the job that you should be doing, quite honestly. Is that if you're not in this field to actually help people and help anybody that walks through your door and is asking for help, then maybe the helping profession isn't for you. So I'm going to end it all there. That's a lot of kind of babbling on, but I think it's really important that we understand that, you know, so much of what we talked about or what we are talking about is not based in fact. It is based in racism and discrimination and a foundation of religious views on our society.
Thank you so much, Kayla, for enlightening us with your very, very on point analysis. As you were talking, I was remembering that Saskatoon's history is actually a temperance community, right? And it's rooted in like colonial, Victorian, you know, Christian morality that really permeates a lot of what we do. Is mediated by this idea of, you know, white moral superiority, you know, white people going to educate the poor and the indigenous people about how to parent, you know, moral hygiene. Even gentrification now feels like that, right? When they remove the liquor store and they put the fancy bars and they say, we're going to teach the poor people how to drink properly. So how all these conceptions that we have are so mediated by the larger narratives that there are. So I think it's so important and critical what you said, that it's really how we're processing and interpreting reality is very mediated by that bias that many of us have been socialized about: racism, about class, about who's deserving of care. And that's huge here when we know that people that come from marginalized and minoritized communities and come to healthcare, they are perceived as non-deserving, people that are non-deserving of care, or that are abusing the system, or people who, entire communities that are perceived to be in deficit of something like moral education. So thank you for bringing that up. And I like that you're really emphasizing that what we need is rights. It's not about charity. It's really about providing the rights that we're all supposed to be guaranteed. I don't know that we have too much time for questions, but I do want to offer the floor for maybe one or two. I saw that there were a lot of clapping when you all finished talking, but I will offer the floor for the audience if you want to chat or raise your hand. We probably can stay for 2 or 3 minutes for a burning question, but I also encourage you to engage and contact PHR, the Students for Harm Reduction and Informed Policy, and Chokecherry Youth Studios too, and find out more or get engaged with what we're doing. Anybody here on, oh, there's a lot of thank yous and agrees. I wonder if people are just feeling the pressure of the time, because it was tight. And we actually wanted to invite, there's more community-led initiatives happening at Chokecherry. We have the snack guy. So shout out to Tuck, who we love. And we want to make space to share and highlight and amplify some of other things that are happening in community. So we'll have to have a follow-up session very soon, and hopefully we'll have more good news to share. But I really want to thank you, all of our panelists today, and I'm going to ask our audience if you can join me in a emoji or real round of applause. You can unmute yourself and also give like applause, make a lot of noise. And we really value the work that you are doing for our community, and we recognize that it's a collective effort, that we need to be in solidarity and supportive of all the efforts that are happening in community, and use our voices and our privilege to advocate for what the government should be doing, which is provide all of us with our basic rights. Panelists, any final words? Events to plug? No? Well, then I'm gonna ask you to stay put for our communications moving forward. We're gonna be sharing the recording of this, as well as other resources that we may collect for you to keep educating yourself and others around harm reduction and the need for our decisions to be based on scientific evidence and not biases. Okay, so I'm gonna, again, thank you everybody, and I hope you have a wonderful day. You will receive, I think, also our evaluation, our feedback, contact, email for you to send us suggestions, and stay tuned to the social media for the DSA as well for more news and events. Thank you, everybody. Have a good day.